My name is Tracey Williams. I am currently working as a community physiotherapist, working for Derbyshire Community Healthcare Trust, based at Babington Hospital, which is in Belper, Derbyshire. I came into physio, I discovered physiotherapy by accident really. When I was younger, I was in the army for a few years. When I left the army, applied for a few jobs and got a job as a physiotherapy assistant. Thoroughly enjoyed it. Worked hard to get my MVQ and did an A-level at night school, and that got me into Coventry University as a mature student. I came out of the profession. I had three quite young children. I had a 3-year-old and 1-year-old twins. And life where they were small was quite simple. You drop them off at nursery and you go and do your job and whatever. But then it came to school time and thinking about how am I going to fit this in with working hours and school holidays, etc. And life got a little bit more complicated. I'd been thinking about return to practice for a little while. I worked in adult care, and I was the opportunity was coming up for a few of us to do our degree to become social workers. And I was looking into this. I had a very, very supportive manager, but who actually said to me, "Why are you doing another degree? You've got a degree. Why aren't you back in physiotherapy? If you want to progress yourself, why don't you go back to what you knew at one time?" So I started looking around. It's something I'd looked at a few times in the past, but there hadn't been the opportunities there. And purely by accident, I found a little link which said, "Are you thinking of returning to practice? If so, register your interest here." And I clicked the button, and that put me in touch with Paul. Got an email back in a very short space of time. Before I knew it, we were having the conversation, and he was telling me all about the opportunities that there were out there, and that just started the journey. Paul put me in touch with the return to practice lead within a couple of local trusts, and I made a few phone calls there and set up a meeting with the trust that was local to me. And we had a good chat about what opportunities there were within that trust, and that also gave me the confidence. She was very complimentary and gave me the confidence to think I can do this. I've got a lot to offer a role. And she gave me the chance where she let me know there were 2 routes in. So we could do a placement, a clinical placement, or there was kind of on-the-job training really, which was something that I preferred the look of, as I wanted to return to practice but still had a mortgage to pay. So started applying for jobs and speaking to managers within those applications, making the phone calls and saying what are the, can your department support me and what are the opportunities out there. I went back to practice as a band 4, or paid as a band 4, whilst working under mentorship of the physiotherapy team to get my skills up within that community team. And once my skills were back up and I'd done my allotted amount of days clinical practice, then re-registered with all my evidence there behind me. So that was my way in. Slightly terrifying, not knowing how things had changed, how much things had moved on, but also comfortable. It was nice, almost like going back to something that you knew, and realising that actually you'd quite missed it. But yeah, still terrifying. The best thing for me about having returned to practice was feeling that I'm doing my worthwhile role again, doing a job that I really, really enjoy. I also feel I've got my strength back, I've got my independence back, and I'm just thoroughly loving what I'm doing at the moment. If you feel terrified, that's normal. Don't be afraid of being afraid. That's perfectly normal. We all go through that. Think about why you left in the first place, because when you go back, it's an opportunity for a fresh start. And think about what you do want to go back to as well as what you don't want to go back to. It's a great chance to start again. Not quite reinvent your career, but to go down maybe a different path to the one that you were previously on. So grab that opportunity and just go for it really.